Hello, I'm Dr. Mark Nolan, an optometrist at Revision, one of the dry eye doctors here, along with...
I'm Annie Mueller, one of the other optometrists here at Revision.
And we would like today to discuss our treatment options for dry eye syndrome. It's one of the most common things that we see here at Revision. It can affect your comfort, your vision, and we need to treat that and help you. So we start simple here at Revision with what's called an eye comfort box. There's 4 things in here that synergistically work together. It's a 2-month supply. We see the patient back after 2 months. If they're doing well, awesome. If they're still struggling a little bit, then we have other treatment options.
Our next step in our toolbox with dry eye is to use punctal plugs. A punctal plug is a small little piece that goes into the punctum in the lid here to help hold the tears in our eyes longer. We first start with disposable plugs, and these disposable plugs will last in the eye up to 90 days. We then will see the patient back, and if this is helping them, we will stick with that treatment and we can put in permanent plugs. If not, we do have other tools that we will step up to next.
If the patient's still struggling after using the eye comfort box and punctal plugs, and they find that they're still having difficulty with their vision or their comfort, itchy, dry, irritated eyes, red eyes, then the next option down this process pathway to help patients with dryness is called intense pulse light. First, it came out in 1995 for dermatology, and the dermatologist found that these patients with treatment for acne rosacea across their cheeks, they were finding that they had less dry eye symptoms. So how this works is it helps to open up the meibomian glands, which help produce oil. Often as we get older, the meibomian glands become hardened and they do not flow properly like olive oil. So this helps to open those up. And we do 3 treatment plans spaced a month apart. And the vast majority of people with IPL definitely do better, because once those meibomian glands are unplugged and working and flowing properly, then their tears aren't evaporating. That's one of the main problems with dryness, is we make tears, but then they just evaporate. So we need to make sure that their meibomian glands are open and that we address that. After they've had 3 treatments with IPL, we reassess. Again, very few patients are struggling after IPL, but we still have other options, which include
Medicated drops. One of the main drops that you've probably heard of in the past is Restasis. There are many drops on the market these days, but we try to avoid putting you on drops that you may need for the rest of your life. If they are needed, they do work, but we want to try all of these other tools first before we go to this last option.
But here at Revision, we like to start off simple, and we just work down that pathway. We don't like to do a full court press all at once. We like to start simple, see how the patient does, and go from there.